I want to talk about only having local anesthesia when having a wisdom tooth pulled. So I'm here with Boo, and Boo had a tooth extracted today, and I also had a tooth extracted today. I had a broken wisdom tooth, and the dentist that I go to said there's really no way that they can fix it because the nerve was exposed. And they said that the best thing for me to do would be to have the tooth extracted. So that's what happened to me today. Today was my appointment to have it extracted. So I wanted to talk about that because when I was making my decision on what to do, I was looking online and doing some research, and I just wanted to make this video in case anyone else is looking for the same information. So I had a broken wisdom tooth. It was tooth number 1, so it's on my upper right. It is like the farthest tooth in the back of the upper right section of my jaw. Hello. And the reason why it broke is because it had an old silver amalgam filling in it. And I don't know, maybe 10 or 15 years ago, I went to a holistic dentist who told me that silver amalgam fillings are notorious for cracking teeth because what happens is they expand over time and they create fine cracks in the teeth, and then eventually the teeth can break. So at that time, what I did was I had all of my mercury fillings removed. I think it was like 2 or 3 of them. The only one I did not have removed was the one in the wisdom tooth. And the reason why I didn't have it removed was because when the dentist put that filling in, maybe 10 years prior to that, I remember feeling it. Like the Novocaine did not really work that day. I don't know what was going on. I don't know if the dentist just had an issue with putting the Novocaine in, but I just remember a lot of pain getting that tooth filled. So I was always very hesitant to have anything done with it. So that's why I didn't have the mercury removed when I had the mercury removed on the other teeth. Anyway, sure enough, what happened a few months ago was that I was eating an apple, and then all of a sudden I was like, well, wait a minute, it feels like part of my tooth is gone. And then when I went to the dentist a week later, they confirmed that, yeah, part of the tooth broke off, part of the filling broke off, and since the nerve was exposed, they really didn't want to touch it. They said I should go to an oral surgeon and have it removed. Even though the dentist did extractions because it was a wisdom tooth, they just thought my experience would be better if I went to an oral surgeon who could, they said an oral surgeon could pull it in like 5 minutes. They're just, experts at that, much more so than a typical dentist. So that's what I did. And so today was my appointment, and I chose to only have local anesthesia. And this is what I want to talk about. I want to talk about only having local anesthesia when having a wisdom tooth pulled. I don't think I would recommend that if someone was having like all 4 wisdom teeth removed, or I don't know, maybe even like 3. But for just 1 tooth, it wasn't that bad. So what happened was I did not even have to have like a consultation appointment because they're like, okay, if it's only 1 tooth, you really don't need a consultation. We could just deal with you the day you come in. So when I went to the oral surgeon today, the first thing they did was put me in a consultation room, and the oral surgeon took a look at my x-rays, and I explained that my tooth had broken off even more since the x-rays I had taken 2 months ago. And she asked me if I had any pain or anything. I said, no, I have no pain at all, which I always thought was weird because the dentist told me the nerve was exposed. But they also said, well, sometimes it could be necrotic and sometimes you just don't have pain. And I had no pain. I told them I had some sensitivity a few weeks ago, but since the tooth had broken off more, I didn't even have that. I had no sensitivity, no pain, and half the tooth was gone. She said it would be no problem. She confirmed that it was only going to be local anesthesia, which is what I wanted. And then the next thing that happens is she left the room, and then the people that handle the billing came in, and we did all the billing ahead of time, which was great because, after the procedure, you then don't have to deal with any of the billing. So after, I dealt with insurance and all that, then they take you to the exam room. And in the exam room, the oral surgeon gave me the Novocaine shots. It was 2 shots of Novocaine. And then what was interesting was they put on a film, and the film is all about your aftercare and, you know, what you should do after your surgery, what you should not do after your surgery. So that was kind of nice. And after the film is over, I guess they have it timed like perfectly as to how much time it should take for the Novocaine to start working. Then the oral surgeon comes back in and she's like, how you feeling? Feeling numb? I'm like, yeah, I'm pretty numb. So she tests out the area and everything was fine. And I don't know, it kind of felt like then I got a third shot when she did that, but I'm not sure about that. So then she tilted the chair back and she's like, put your chin up, move your head this way. And she's like, you're going to feel some pressure. And I was like, okay. So obviously knowing that they're just yanking a tooth out, then, you know, your mind starts imagining things. So you do feel a lot of pressure. Like you feel like someone is yanking a tooth out of your head. You don't have any pain. I had no pain during the entire procedure. No pain at all. But a lot of pressure. Like imagine someone pulling a tooth out of your head. That's what it feels like, but it doesn't hurt. Like there's no pain. And then you can actually kind of feel it kind of like rising out of the socket, if that makes any sense. You can kind of feel them trying to like wiggle it out. It's a combination of wiggle and pulling, which you can feel. You could feel the wiggle and the pulling, but again, there's no pain. And then all of a sudden there's a release. There's a release and they're like, okay, it's done. And then they put gauze in your mouth and they're like, okay, bite down on the gauze. And that's it. Like literally minutes. Like it might not have even taken 5 minutes. Like maybe it took 2 minutes, 3 minutes tops. That was it. I was like, really? That's amazing. That was the quickest dental procedure I've ever had. Like, I mean, it was so fast. So they just pop the tooth out and then they put the gauze in. They say bite down on the gauze and keep pressure on it for like 15 minutes. And then they gave me a bunch of prescriptions. So she gave me a prescription for antibiotics, a painkiller prescription, a heavy duty painkiller prescription, which she said is, you know, only if you absolutely need it. And then she gave me like a mouth rinse prescription. And they, you know, they send that electronically to the pharmacy so you can then pick it up like on your way home or have someone pick it up for you. And she also gave me a bunch of extra gauze. And she said, you know, bite down on the gauze and change the gauze like every 15 minutes or so. And keep changing it as long as it's bright red. And then when it starts getting to be a darker color, you don't have to change it as much. So I ended up keeping gauze in my mouth for almost an hour because like every time I took the gauze out, I was like, well, it looks bright red to me. So I would put more in and then take it out and I was like, it looks bright red to me. They also gave me a whole bunch of information as far as aftercare. And one of the things says that if you're still getting a lot of blood on the gauze, bite down on a tea bag because the tea will actually help the blood to clot. So I bit down on a tea bag for like 20 minutes and then I feel like it really helped just stop the bleeding. So that was good. But I did want to give it like a chance to just do that on its own before I did the tea bag. So probably for an hour in total is when I had the gauze in my mouth. Also, what probably did not help me was that in the first half hour or so of having gauze in my mouth, I was talking. Try not to have conversations with anyone. Try to just rest and keep your mouth shut and relax and don't talk. And if there's people around you that want to talk to you, just tell them, talk to the hand, don't talk to me right now, because it will definitely help you stop bleeding faster. So try not to talk to anyone, even if they're insisting on having a conversation with you, just don't do it. Just try to be quiet and keep your mouth shut and stop the bleeding. So if you are going to have a wisdom tooth removed and you are thinking of going the route of local anesthesia versus general anesthesia, I just wanted to put this information out there because I know when I was kind of looking up information, I would have liked to have seen someone say this on a video. I wasn't really able to find that. So for one tooth, maybe two teeth, it's not bad with the local. The worst part of it was just really feeling the pressure of someone pulling a tooth out of your head. But like I said, there's no pain at all. So Like if you're good at distracting yourself mentally, that would probably be a good thing to do. But I feel like it was really, really worth it. Much better than going under general anesthesia. Recovery time will just be quicker. I was able to drive right after the procedure, and I didn't have to have someone drive me home. Even though I had someone with me, I could, you know, be the one doing the driving and stuff. So that is the situation. Now, as far as aftercare, obviously they say don't eat anything crunchy. They said don't eat anything crunchy for like 2 weeks. Focus on just eating soft food. Obviously for me, I could eat on the other side of my mouth because it was only on one side of my mouth. Don't sip anything through a straw. Like, if you're a smoker, obviously don't smoke, and don't drink anything through a straw for about 2 weeks. But it's pretty simple stuff. Like, you know, focus on soft food is the really big thing, and rinse your mouth out multiple times a day. That was another thing. Every time you eat something, rinse your mouth out with warm salt water just to, you know, keep the area clean. And warm salt water is also like antibacterial. And, oh, I can't brush my teeth or anything like that for 24 hours now. I think those are the main things, and I'm really sorry that Boo is licking his butt right now, but Boo also had a tooth extracted today. So I hope this video was helpful for you if you're thinking about having a wisdom tooth removed under local anesthesia. Not bad at all, not painful at all. The worst part is just the pressure that you feel when someone's pulling a tooth, but other than that, it wasn't bad. And it's over really, really fast. Thank you for watching this Lucky Ferals video. If you enjoyed it, please give it a thumbs up. Please subscribe if you'd like me to post more videos, and please make sure to check out these other videos that were selected especially for you.